Hello dear students, welcome to GDC. Today we will going to discuss about the question that has been asked in your recently, that is your medical and health service requirement board. So today we will discuss the second part of second shift exam. So let's start our discussion. So let's come to the question number 40. Yeah. So let's come to the question number 41. So the question is the cardiotonic drug that primarily increases. So what this cardiotonic drug primarily do? So they primarily increases the heart rate, blood pressure, heart rate, respiratory rate, yeah, cardiac rate. Remember the drug that is cardiotonic drug. Cardiotonic means those which increase the heart rate, basically not the blood pressure. Sorry, cardiotonics they basically increase the contraction, okay, like class of the digitalis, okay, digitalis class of the drug. So they basically increase what? Cardiac contractility, okay. Option 4 is the correct answer. So moving to the next question, ondansetron is effective in controlling chemotherapy induced nausea and vomiting. Okay, so this is asking about which receptor they are basically working, whether it is 5-HT1, 5-HT4, H2 antagonist, yeah, adrenergic antagonist. So remember, ondansetron is basically 5-HT4 antagonist. If you ask about the specific one, then it is 5-HT3 antagonist. Specifically, this is a 5-HT3 antagonist, and it is basically given in which condition? These all given in case of controlled chemotherapy induced nausea or vomiting. Okay, so moving to the next question, lorazepam, these are basically ben benzodiazepine class of the drug. Which class drug? They are basically your benzodiazepines. Okay, so question is asking about they are implicated in which of the following condition? Diuresis? No. Enzyme production in liver? No. Gametosides? No. Yes, this is given as apnea in premature infants. Okay, in case of premature infants, they are basically given. So moving to the next question, which antihypertensive drug is contraindicated during pregnancy as they are associated with fetal damage? Okay, so there is a mnemonic to remember what are the drugs that is safe during pregnancy. Okay, so there is a mnemonic which is basically there for the remembering what are the drugs that is safe during pregnancy. Okay, so how to remember this? Okay, let me tell you how you are going to remember this drug. So the trick is new mother. Okay, so the trick is new mother. Okay, or you can remember new mother need better care. Okay, you can also remember new mother need better care. So N stands for nifedipine, methyl dopa, beta blocker. So these are basically comes under your drug that is safe during pregnancy, but this ACE inhibitor that is contraindicated in pregnancy. This is a teratogenic drug. Okay, this is a teratogenic class drug. Okay, so option A is the correct answer. Moving to the next question, which statement is false about plasma expander? Please highlight this. Is asking about false. Okay, so about plasma expander. So what is plasma expander? So plasma expanders are the class of the drug that is basically used to increase the plasma content. So during, you might have read that during different shock condition, hypovolemic shock or cardiogenic shock, basically the plasma volume basically reduced. To increase this condition, we basically provide this plasma volume expander. Question is about which is following is a false. Substitute for the plasma, yes, this is, as it is a plasma volume expander, we are giving as a substitute for plasma. In hypovolemic shock, severe burn, yes, in case of hypovolemic shock, in case of severe burn, both the cases the plasma quantity basically reduced and they are basically given during this condition. Dextran is a, yes, dextran, remember dextran is basically is a ideal plasma expander. 5% dextran is basically used for the treatment. Okay, so they have oxygen carrying capacity. No, this does not have oxygen carrying capacity, because who carries oxygen? Oxygen carries by this hemoglobin. Okay, so that's why this option is false. Okay, so moving to the next question, which drug is a aldosterone antagonist used as a potassium sparing diuretics? Okay, which of the question is asking about basically which of the following is a potassium sparing diuretic and it is an aldosterone antagonist? Mannitol is not, because it is a osmotic diuretic. Okay, this is a osmotic diuretic. Triamterene, this is a potassium sparing diuretics, but it is a direct sodium channel inhibitor. Next one is hydrochlorothiazide. Hydrochlorothiazide is a, yes, thiazide diuretics. Okay, this spironolactone is a basically is what? This is a potassium sparing diuretic and having and so antagonistic effect against aldosterone. Okay, so next question, which of the following is a intermediate acting insulin preparation? So this is asking about which of the following is basically a intermediate acting insulin preparation. So insulin preparation, you know, the insulin classification can be, you have divided into several class. One is your ultra short acting, one is your ultra short. So this is, you can remember three names, GLA, glulisine, lispro, aspartate. So glulisine, yes, glulisine option is cancer. Insulin gargine, long acting, if we'll talk about long acting insulin, two long acting insulin is there. One is your uh, glargine, and insulin determine. Okay, this is basically your long acting insulin. This is about intermediate acting insulin. In intermediate acting insulin name is, one is your isofin insulin and another one is your NPH insulin. One is your isofin insulin, another one is your NPH insulin. Okay, I hope all of you are understanding and you can match your you can match it from what are the what option you have choose. You can check whether this option is correct or not. Okay, so let's move to the next question. Yeah. Question number 48 uh, is which is a H2 receptor antagonist used in the treatment of peptic ulcer? So it is asking about peptic ulcer disease and each receptor, that is H2 receptor antagonist. Omeprazole, yes, it is given in peptic ulcer, but it is a which class of the drug? It is a PPI, that is your proton pump inhibitor. Metronidazole and clarithromycin, yes, these two is given in case of peptic ulcer, but this is comes as a antibiotic. These are used as antibiotic against H. pylori. However, this ranitidine, cimetidine, these are basic famotidine, these are comes under your H2 blocker. Okay, they are called as, they are given as a H2 blocker in the treatment of peptic ulcer. So moving to the next question, one of the following is a adverse effect of pyrazinamide. Yes, so pyrazinamide is a which class drug? This is a anti-tubercular drug. Okay, this is a anti-tubercular drug. So remember how you can remember there are five and this is a first line anti-tubercular drug. Okay, first line anti-tubercular drug. This is asking about the adverse effect. Neurotoxicity, no. Flu-like syndrome, no. Acidosis, no. Yes, the hyperuricemia. This basically create a gout-like condition. Okay, gout-like condition it can create. So option second is the correct answer. So moving to the next question, most common side effect of streptomycin. Okay, streptomycin, what is the most common side effect? So remember, streptomycin is a which class antibiotic? This is a aminoglycosides. How they basically show this mechanism of action? By inhibiting protein synthesis. Okay. So this is aminoglycoside acts by inhibiting protein synthesis. Remember the major function of this or major toxicity that is shown by this aminoglycoside class of the antibiotic is ototoxicity. Okay, it basically damages the hearing process. So option third is the correct answer. So moving to the next question, which of the following is orally effective in treating candida infection? So candida is basically a fungal infection. So question is about which of the following is given as a candida infection? One and orally. Rifampicin and isoniazid, this will be not because these two are anti-tubercular drug. These two will be the answer, but question is orally when it is oral. Fluconazole is basically given orally, not amphotericin B. Okay, amphotericin B does not given orally. Okay, so fluconazole is basically given as a oral. Next question is which drug is a reverse transcriptase inhibitor of HIV therapy? So HIV during human immunodeficiency virus cases. Which one is basically given as a uh, inhibitor of reverse transcriptase? Okay, so what will be the answer? So here the correct answer will be your what 𝘎𝙎𝙎𝙎. But let's see why this will be the correct answer. Okay, first thing is why this will be the correct answer. Let's see the if we'll see the mechanism. So this uh, 𝘎𝙎𝙎𝙎, so 𝘎𝙎𝙎𝙎 is basically inhibit your the RNA dependent DNA polymerase enzyme. Okay, so 𝘎𝙎𝙎𝙎 it is basically inhibit RNA dependent DNA polymerase. Okay, RNA dependent DNA polymerase. What acyclovir do? Acyclovir is an antibiotic that basically inhibit the DNA polymerase. Okay, what it inhibit? It basically inhibit your DNA polymerase. Okay, this basically inhibit which enzyme? Your DNA polymerase. So next is your oseltamivir. Oseltamivir, how it basically act? So this basically act by inhibiting protease HIV protease enzyme. Okay, it inhibit basically your HIV protease enzyme. And last but not the least, your ribavirin. How this ribavirin will act? So ribavirin is basically act by inhibiting GTP and viral RNA synthesis. Okay, inhibiting GTP and viral RNA synthesis. Inhibits GTP and your viral RNA synthesis, because from the RNA the protein will be synthesized. So this will inhibit this process. Okay, so this is your option third is the correct answer. Okay, so moving to the next question, which of the following is a anti-helminthic drug? Anti-helminthic drug but used to treat intestinal worms. So in case of this, mebendazole is correct answer. So mebendazole is anti-helminthic that is used in case of intestinal drugs. Okay, so primaquine is not. Primaquine is a anti-malarial drug. Okay, metronidazole, tinidazole, these are not. Okay, so next question is, which of the following is a alkylating agent used in chemotherapy? Okay, alkylating agent. So cyclophosphamide, your methotrexate is which class of the drug? This is basically a anti-metabolite. Okay, so cyclophosphamide is basically comes under your what? This is your alkylating agents. Okay, so moving to the next question, which of the following includes in the hospital formulary system? Which of the following is includes in hospital formulary system? Stock management, which includes, okay, yes, stock management is included. Patient drug history, yes. The hospital formulary is basically what? This is a book that basically records a detail about this information related to a particular hospital. Financial audit, yes, but list of approved drug not. List of approved drug is not in any related to this hospital formulary system. Okay, the question is about which of the following is included in hospital formulary system. Sorry, so the question is, yeah, the question is which of the following included in the hospital formulary system. So if your question is about included, so that is basically list of the approved drug that will be included. Okay, so moving to the next question, which of the following is a standard, which of the following standard is applied for strapping? So for the strapping process is basically, remember, the tensile strength is basically uh, used as a standard. Okay, the tensile strength. So option 3 will be the correct answer. The first symptom of rheumatoid arthritis. The first symptom of rheumatoid arthritis includes pain in the joints of ankles and elbow, pain in the small joint of finger and toes, pain in the joint of hip and knees, pain in the shoulder. So remember, first symptom that is applied basically the small joint areas. Okay, the small joint areas will be affected first. Okay, next question, the treatment option for paracetamol poisoning. So paracetamol poisoning basically occurs due to a paracetamol metabolite, that is your NAPQI, N-acetyl para-amino benzoquinoamine. Okay, so to treat this, which is given? Not penicillamine, not nalorphine, not disodium edetate. Okay, so these N-acetylcysteine. So N-acetylcysteine is used as a drug of choice in paracetamol poisoning. Okay, please remember, drug of choice in case of paracetamol poisoning. So moving to the next question, which hormone is primarily responsible for the increasing blood sugar level in response to hypoglycemia? Okay, which increase the blood glucose level. So when it is asking about increasing blood glucose level, the glucagon will be correct answer. What insulin do? Insulin basically treat hyperglycemia. Okay, insulin what do? Insulin treat hyperglycemia. Okay, that means insulin decrease the blood glucose level. So insulin, what insulin do? It basically decrease the blood glucose level. Okay, so okay, so moving to the question number 60, drug information bulletin. Drug information bulletin contains information except safety alerts, yes, contains new drug approved by CDSCO, yes, content new advances in medical device, yes, but not the list of medication used in the hospital. So the drug information bulletin is not related to your medical, what are the list of medication that is there in the hospital. Okay, so next question is, which of the following test is used to cardiac identify a cardiac glycoside? So for the cardiac glycoside, the Killer-Killiani test is used, but some book it has been written Baljet test, but Baljet test and Killer-Killiani test both are used, but the more specific one is your Killer-Killiani test. That's why option 2 is the correct answer. Okay, option 2 will be the correct. Braun-Trager test is used for the anthraquinone glycoside. Okay, Braun-Trager test is used for the anthraquinone glycoside. So moving to the next question, 𝘂𝙎𝘶 seed belonging to the family what? 𝘂𝙎𝘶. Okay, 𝘂𝙎𝘶 is basically belonging to your Loganiaceae family. Okay, it's belonging to Loganiaceae. Which of the following is identification test for aloe? Yes, just now I have tell you. So for the anthraquinone glycoside, we have aloe is comes under a anthraquinone glycoside. Okay, this is comes under a anthraquinone glycoside. Okay, so two tests is basically employed. One is your Braun-Trager test. Another one is your modified Braun-Trager test. Okay, so option A is the correct answer. So moving to the next question, the organoleptic, that means here your organs are basically used, sense organs, used related to taste and smell in the herbs, that is primarily. So we sometimes we do either by smelling or by tasting, we identify this plant. So this basically about what? This is basically about quality. By smelling something or by tasting something, I will tell you that yes, this is a plant of tulsi, or this is a plant of 𝘂𝙎𝘶 and other plants. So this basically organoleptic property related to quality. Yes, this is this quality or proper quality or not. Okay. Next question number 65. Name the drug that belonging to the Asclepiaceae family, indigenous Deccan Peninsula, northern and western part of the India. So which is basically located in this region and having family Asclepiaceae. So your right answer is Gymnema. Gymnema is used for what? This is used as a anti-diabetic plant. Okay, this is used as a anti-diabetic plant. Please remember. Okay, so these things have already been discussed when we are talking with you about this theory class. Okay, so next question is identify the correct one from the following. Which of the following is correct? Cardamom, cinnamon, and myristicin. No, myristicin is present in nutmeg. That's why this option is incorrect. Coriander contains linalool and eugenol. No, eugenol present in clove. Okay, nutmeg contains both myristicin and terpenol. Okay, that's why option C is the correct. Option third is the correct answer. So moving to the next question, the plant that is capable of arresting hemorrhage and reducing the secretion of mucous membrane in the stomach or intestine. Okay, so this is catechu. The correct answer will be catechu, because remember this catechu is basically employed in case of peptic ulcer. So what it causes? It basically arrests the bleeding um, and reduces uh, the excess mucus secretion in the stomach. Okay, sorry, reduces the secretion of the mucous membrane. Okay, so this is basically employed in case of peptic ulcer. Okay, so moving to the question number 68, which of the following used for the preparation of mosquito repellent? So question is about which of the following will be given for the preparation of mosquito repellent. Your option is Pyranthemum, Shankhapushpi, Satabri, Picroryza. So remember, the mosquito repellent property is basically there with your pyrethrum. Okay, so it is there with the pyrethrum. So moving to the next question, 𝘂𝙎𝘾 deficiency. Okay, yes, this is a question related to biochemistry. Okay, 𝘂𝙎𝘾 deficiency is disease related to what? This is metabolism deficiency due to protein. I told you na, protein deficiency. Protein deficiency is associated with 𝘂𝙎𝘾 disease. Okay, so option 2 will be the correct answer. Question number um, 70, the pathological condition of ketosis. Ketosis is what? When there is a formation of ketone bodies increases in the body, that leads to ketosis condition. Severe exercise, kidney disease? No. Yes, when there is a fat metabolism and you are for a starvation period and during diabetes, in all three conditions, basically the production of ketone body increases and that leads to a condition called ketosis. Okay, so moving to the next question number 71, which of the following is not related to glycogen storage disease? Cori's disease, yes, it is a glycogen storage disease. Pom's disease, Which disease? Yes, Graves' disease not. It is a disease related to lipid metabolism. Okay, this is related to lipid metabolism, not related to glycogen storage. Okay, so moving to the next question, which of the following abnormal constituent of urine may suggest UTI? Urinary glucose? No, glucose basically urine glucose in urine basically indicating is what condition? Diabetes. Okay, it is indicating about diabetes. Ketone bodies, no. Pus cell. So pus cell is basically indicating the infection. Okay, pus cell is a marker for infection. So when there is pus cell is found in your sometimes when we do the culture of our urine, so we will found that yes, there is a pus cells, number of pus cells 3 to 5% or 5 to 10%. When the pus cell percentage increase in your urine, that basically leads to it what? This urinary tract infection. So come to question number 73. Vitamin B12 absorption requires the presence of what? Extensive factor, intrinsic factor, minerals or lipid. So when I was talking teaching you about vitamin, I told you that vitamin B12 absorption is occur simul is vitamin B12 absorption requires IF, that is intrinsic factor. Okay, IF is basically required for the absorption of vitamin B12. So okay, so that's why option number 2 will be the correct answer. So moving to the next question, question number 74. Which of the following is not correct? Okay, lecithin helps in digestion as well as absorption of lipid from the GIT. Plasmogen are present in brain and muscles. Sphingomyelin are present in brain and nervous. Galactolipid present in liver and spleen. No, galactolipids are not present in liver and spleen. Okay, so moving to the question number 75. Under Pharmacy Act, okay, Pharmacy Act 1940, has the who has the power to remove the name of the registered pharmacist? Central government? No. PCI? No. Drug control? No. Only the state pharmacy council. Remember, the state pharmacy council have the power to remove the name of the registered pharmacist from the register. Okay, not the state government, not the central government, not the PCI, not the drug controller. So moving to the question number 76. As per the Drug and Cosmetics Acts, the regarding retail pack size of the drug. So when it is about pack size, so remember it is related to P1. Okay, AS is related to cosmetics. Okay, so pack size, when it is asking about pack size, so P1 will be the correct answer. Okay, so moving to the question number 76. Under the Poison Act 1999, okay, oxides of mercury are categorized as list A, list B, list C, and list D. So remember, according to the on Poison Act 1999, these mercury oxides are basically categorized under list B. Okay, so question number 78. The Pharmacy Act 1948. So the Pharmacy Act 1948 regulate education and profession of the pharmacy, pricing the medicine, import of drug, sales of narcotic substance. So remember, this Pharmacy Act 1948, this is basically regulate the educational development, education and profession related to pharmacy. Okay, so pharmacy who have the role of the major function or major goal of this Pharmacy Act 1948 is it is basically regulating the what we can say education and profession of the pharmacy. Okay, so moving to the question number 79. In the medical termination of the pregnancy, MTP 1971, the term guardian refers to what? So guardian means what? Superior officer? No. A person who protect or guards the property? No. A person legally responsible for an older woman unable to manage her affairs? No. Yes, the guardian is a person who having the care of minor or mentally ill person. If a person who is taking care of a minor or a mentally ill person, that person is basically comes under a guardian. Next question is, which of the following is not classified as a narcotic drug under NDPS Act 1958? Which of the following is not a classified? So narcocaine, yes, it is classified. Heroin, yes, it is classified. Cannabis, yes, it is classified. Reserpine, no. So reserpine is the correct answer. Okay, so dear students, I hope all of you have uh, checked your question paper according to the today's discussion. So please check this question paper correctly, and I hope all the best. Uh, all of you have done good work in your exam. I hope, I wish all the best to all of you for your qualification. Okay, advance congratulations to all of you. Thank you so much.